Hi, everybody. Thank you, everybody, for being here tonight. It really means a lot to have everybody's support. That's one of the biggest things that helps us get through our daily life, is having the love and support of everybody in our family, our friends, and just want to thank everybody for being here this evening. It was very humbled that Michelle asked me to tell my story about being a fire wife. It meant a lot to me to want to be able to tell my story. I'm sure a lot of fire wives and actually fire husbands out there that may have gone through some things that I go through on a daily basis. But being married to a first responder is not only an honor, but it's also a challenge. And if I didn't have the family support that I have, it would be very difficult, I have to say, to tell my story, but here we go. I'm just going to tell you a little bit about myself. Dustin and I actually have been married for over 17 years. He's been in the fire service for almost 20. We met actually in the ER, and literally, as he was saying, it was love at first sight. Actually, as soon as we met, we never left each other's side, and that was, it really was love at first sight. What was pivotal in our relationship was when we did meet. Dustin asked me to marry him probably within 3 months. And when we got married, it was a 100% the best day of our lives. We actually got married at my mother and father-in-law's home in their yard by their garden house, and it was the most beautiful day of our lives. Although I'm looking back at this picture and I'm seeing to have and to hold, and I mean, looking at Dustin, and he actually has hair. He doesn't have hair any longer, but that's another story. Just wanted to let you know that through the early years of our relationship, when Dustin was a first responder firefighter, I was in the medical field, worked in the ER, and then we moved into our home and started a hobby, which I'll get into later. But it was a big focus of our life, is staying connected with each other and never losing focus on what truly was important in our hearts, and that was being with one another no matter what. I'm bringing the next slide up, and I'm going to try and do this without crying. I never realized the importance or the extreme, I want to say the extreme dilemma that I was feeling when I got a phone call one night from, it wasn't Dustin, but it was from his lieutenant, that he was in an accident. And when I look at these pictures, I'll never forget this day. But I truly, for 13 years of being married with Dustin, I didn't realize the impact of what the fire service really was until I saw Dustin go through this pain with, he was on a fireboat, he was on the boat at his station, and he was blown up in that boat, which caused him to have these 3rd-degree burns over 20% of his body. It was a devastating phone call, all I can say. I didn't have the words. All I know is I'm grateful that I had my in-laws to be by our side to get us through that point. I did not know what to do. I did not know where to go. I just know I needed to be there with Dustin. Wasn't going to leave his side. I also want to say that I also learned what true brother and sisterhood is with the fire service. As a fire wife, I was oblivious, and unfortunately, until something like this happened to Dustin, his brothers and sisters were there for him, for support, for anything that we needed. And I'm talking not only for the county that Dustin works at, Indian River County, but from counties all over the state of Florida, Georgia, California, everywhere. It was an amazing, amazing brother and sisterhood in the fire service that really helped, I have to say, not only trying to help Dustin get through this pain, but also with me myself. And I will be forever grateful in that. Dustin was a true trooper on this. He wanted nothing more than to get back to work. It was a struggle for me, but he focused on getting well so he can get out of the hospital. We, when we got home, we had a plethora of get well cards and thank you cards for being a first responder and being who you are. And I will always remember that those boxes that were being delivered to our house that were sent to the EOC from all over the world. These were getting, his story got out, how he was hurt, and it was an amazing, truly heartfelt healing for me to know that there were so many people that were with Dustin and I going through this journey together. Sorry about that. So when we got home, it was really hard because I was not ready for Dustin to go back to work. I was struggling with my own emotions, trying to stay strong for Dustin. It's hard, but staying hard for myself was, I know, even harder for Dustin. He just wanted to get back to work. So with the approval of the doctors, he was able to go back to work. He struggled though. He struggled immensely with depression, and I didn't know how to help. I was lost. I have to tell you that I didn't know what to do. I got a phone call one day at work, and I will make this story short, but it's important. But I got a phone call at work, and it was Dustin, and he was crying. He wouldn't stop crying. It was, I can't even explain it, but he was just so lost. And as I'm trying to calm him down on the phone, I'm texting his brother, William, who works for St. Lucie County at the time. And I'm texting him and I'm telling him, please go over to our house and make sure Dustin is okay. And God willing, he did. And I'm forever grateful for that. I look back at that and I know that was a very, very dark time in Dustin's life and in his heart. And at that time, Dustin reached out to their EAP at their fire department, and was, needless to say, it wasn't the best of EAP options. And so I did it myself. I didn't care. I found a physician, actually a clinical psychologist in our town. I made a phone call and he told me to tell Dustin to come right over to his office. And for that, I know he saved Dustin's life on that visit. I know he did. So I'm very grateful for Dr. Keith Ebel. I know that for a fact. I just wanted to go through some signs that as I was looking back at the phase that Dustin and I were going through with his injury at work, and I didn't really know the signs and symptoms of PTSD. I really never even heard of PTSD until I started seeing Dustin work for his mission that he is on currently, and I started seeing changes in Dustin's appetite. I also started seeing sleeplessness or oversleeping. I also saw reoccurring nightmares. He would wake up screaming and crying at any given moment. He would be angry at no reason. He would get angry for not being able to get the cup set correctly on the kitchen table. He was very, very distraught. He was very, very sad and depressed. We alienated ourselves because he felt like he didn't want to be around other people, because he didn't want other people to see how he was feeling. And if he was as sensitive as he is, he didn't want people to think that he couldn't handle what he was doing anymore, what he was made to do. And that's what he wanted to do, was to be a first responder. And it was very, very difficult for me as a fire wife to see him go through that and see him go back to work, knowing that all of these signs and symptoms were happening. And I look back every day, I look back at all these signs and symptoms, and I'm just so grateful that we are here today and we're together and we're moving forward. I'm going to 2016. We started getting through the process of Dustin continuing his therapies sessions until we got a call one night that Dustin's lieutenant that he had worked for 13 years, they were stationed together for a very long time in the same station on the Marine unit. He took his life, and that was a devastating phone call that Dustin had to bear. He did David Dangerfield's eulogy. It was another turning point for trying to be strong for not only for his brothers and sisters, but for himself, for me, because David was a very good friend of ours. But we kept trying to stay focused and move along with our daily lives, as they can always so be very distracting with the kids that we have in our lives, our jobs, our careers, our hobbies. We just kept trying to move forward. Dustin started working with the collaborative and staying focused and moving towards a mission towards helping first responders and their mental wellness, if you will, in the fire service. And that was his goal, to make sure that they all knew that they're not alone, just like Dustin wasn't alone. And that was his mission. He made it his mission to help and to support all of his first responders through honoring his scars that he endured through his accident at work. Dustin actually stayed extraordinarily busy. He is a member of the Honor Guard. He's the fire chaplain for his fire department. It kept him going. He not only physically and emotionally was working through his healing process, but he tried to stay as supportive as possible, and he does continue to do this every day. And as a fire wife, I can tell you, I can see 100% when he is tired, when he is needing to be recharged, needs to break away, and it is very difficult to get my husband to take a break. And I'm sure all of you fire wives or fire husbands can probably understand where I'm going through with this. It's very hard to get them to stay still. So he kept going, and we definitely strive to keep a forward motion. And we had another little speed bump. I was diagnosed in October of 2017 with metastatic breast cancer. And of course, everything always happens when we're at work and our husbands are at work. And I got that phone call, and I can tell you, it was a scary thing. I was alone at that time. I was at work, but Dustin at that time was stationed at the furthest station in Indian River County. And as I called him, it literally, and I told him what had happened. I got a phone call from my doctor. Dustin was there within, I'm going to say 15 minutes. I'm not going to say that he broke the law by speeding, but I'm sure that he did. Was there in my office, and we knew we were going to work this journey together no matter what. And by my side and by his side, we were going to do it together. And there was no doubt about it. I had no fear that that was going to happen. Going through treatment was a challenge, I'm not going to lie. but with the support of family and friends, we kept moving along. We did breast cancer walks, we did church functions, we did dinners, we got together with friends at our home. We tried to stay as positive as we possibly could going through this journey with the diagnosis that I was given. And I'll tell you, we definitely every day make it through, and I feel very blessed that I'm even here today to be able to express to you how important it is to embrace every day with your loved ones, every day, because at the blink of an eye, your life can change. So embrace it. Dustin and I moved forward. We kept the momentum going. We, at that time, as I was going through treatment, we celebrated Dustin's promotion into engineer. We just kept the forward motion, and it was an exciting day for us to see us moving in a positive direction, and it was a really, really happy day. Really happy day. Reflection. This is a big word for Dustin and I. What we do is together is we have a hobby. We like to garden together, and our home is our garden. Actually, our yard is our garden, and it is our living room. And we get a lot of peace. We get a lot of appreciation for the simple things, and it brings us back down from our daily lives, from the things that sometimes scare us, and for just reflecting in what really is important, and that is each other and continuing our hobbies with each other. We work tirelessly when we can to stay in our yard, to be at one, if you will, with our yard, and we really, really enjoy something like doing a hobby together. We can definitely continue to share our passion, and we can see that in each other every time that we walk into our yard. Absolutely. Family. I bring this one in because it's so imperative and so important to hold dear to your heart, your family. Whether they're here in Florida or they're in another state, family is the utmost importance. We stay very busy with our family, try to do as much as we can, when we can, when time allows us. I look at this tower to tower run benefit for veterans and first responders. We've done a lot of fun things with our family, with cruises and going to different botanical gardens, and just stepping away from the busyness of life and doing things with our family, even if it's just cooking in the kitchen. We just very much enjoy those memorable things. I'm going to get to the last part of this this journey. Is as long as we both shall live. I hope everybody that's hearing this presentation knows how imperative it is to love each other for as long as you can. Actually, I'd like to read what I wrote, but I can't because the technology is, I'm not a technology person, but behind every success is effort, behind every effort is passion, behind every passion, it takes some with courage to try. Whatever we face and will face in the future, we will do it as one. And I truly believe that 100% that Dustin and I are as one. And I'm blessed to be able to say that. And I can only encourage everybody to hold on to their loved ones and appreciate who they are and what they do for their career. And with that being said, I hope, if anything, I hope somebody gets something out of this presentation. And if they ever have anything that they want to reach out with me, I'm available. I'm sure it's not not difficult to find me if you know Dustin. So I just want to thank everybody for letting me show a little bit of piece of our lives together. And I love y'all. Does anybody have any questions for me?
Well, Miss Lynn, first of all, I'd like to thank you for opening your heart, both of you, to your personal journeys that you've been through. It is a, you can see the pain that you've been through, but the gratitude that other people will have for you being willing to come forward and share your stories is of the utmost value. And I just, first of all, thank you both, but especially you, Lynn, for putting yourself out there this evening. You're a strong woman, and I'm blessed to know you and call you a friend. I have a couple of follow-up questions real fast while we're still recording, and then we'll
Sure.
open the floor a bit.
Okay.
When Dustin was in the hospital, was there anything that you did to care for yourself? Did you ever take a moment for yourself, whether it was to pray or to visit the garden outside or whatever it is? Do you find that there's something that kind of got you personally through that hospital journey with Dustin, or was it solely the outpouring of love that you were receiving that you feel carried you through it?
It solely was the outpouring of the care that I saw from first responders from everywhere, from Orlando Fire, from Indian River Fire. Just it was an amazing. I did not leave Dustin's side, nor would I leave Dustin's side, because that was if Dustin's gonna heal, then I'm gonna heal, and that's how I felt. So I truly believe that the brother and sisterhood that they have got me through it, and that was part of my healing. And actually, to be honest, this presentation was a huge part of my healing, a huge part. And I thank you for that.
We thank you for allowing us to be on that journey with you. So thank you very much for that, Lynn. Do you
Sure.
have any advice for somebody who is a caregiver in your position that's caring for their first responder that are dealing with the physical wounds of the job or the emotional wounds like Dustin went through? Do you have any advice for you as the caregiver? Something that has pushed you closer together? Anything?
Absolutely, caring together. It's not just a one-sided thing. It's caring together. There's times when I want to ask Dustin a million questions when he comes home from work, but I can see it on his face that he needs time to decompress, or he's had a bad call, or I hear this from a dear friend of ours too, a lot from Jeremy Hurd, that the ministry of presence, just being there to listen or to just hold hands or just to hug one another, is a very important part of me and my love for Dustin is to be there for him. And I know that he is there for me, so it makes it even more, uh, more passionate for each other going through being a first responder's wife.
That's a big message that you're giving right now, because what we know about firefighters is, first of all, we're very black and white people, and get to
Oh,
the point and where are we going with this, and but the ability that the two of you are showing all of us here is that you are willing to share with each other what you're feeling, and not allowing yourself to be burdened alone with feelings, but allowing our closest loved ones to be a part of the journey in those feelings. And
absolutely.
so important to recognize that you guys are doing that. And thank you for sharing that. My next question to you was, you mentioned in your speech that subsequent to Dustin's injury and coming home that you alienated, which is a big part of the mental health component of this. Alienation,
Mhm.
is a big part of various different types of mental illness, but specifically to Dustin, PTSD. I know it from my personal journey that I self alienated a lot. And it was a very hard thing to pull myself out of once I was in it. Do you have any recommendations to people that are noticing that that's what they're going through? Steps that you took to refrain from continuing to go down the hole of social isolation?
I think that with me, I didn't push the fact of, okay, well, we need to do this, or I planned on doing this with, so and so. It was a matter of, it was literally baby steps. It wasn't until this day, Dustin, believe it or not, everybody that is on this call, he does not like crowds. But he's in crowds a lot. And I can see it when we are in crowds that he starts to go back into a shell. And it's baby steps for me. It's if they don't want to be in a big crowded situation, or they feel uncomfortable doing a particular activity or a particular function, I think it's important not to push it. Alienation is definitely a scary thing, but doing little baby steps in small groups is an important step for Dustin and I. It was a very, very important step for Dustin and I to go through it together in short steps.
Yeah, and thank you for delivering that message, because social isolation is perhaps one of the biggest burdens of being a caregiver. And we know that it perpetuates a lot of different physical ailments in us as well to be socially isolated. So thank you for sharing that you did that, because it's a difficult journey to do it. I just have two more quick questions for you. Did you yourself ever seek therapy, or did you and Dustin ever seek therapy together, whether that was with someone, a clinician or a spiritual guidance, or did you or Dustin ever do that together, or you, Lynn, by yourself?
I personally did it by myself. Well, I take that back. Dustin and I had a couple sessions with his therapist, and I felt it more as a something that Dustin was working through, and with his particular therapist, I didn't feel like I needed to be there, because Dustin, when he came home, he was a different person. His soul was enlightened. He was somebody that came out of his shell with me, and he learned a lot of different techniques that helped our relationship grow, being that he, was going through this PTSD. And I did go through therapy myself when I was diagnosed with my breast cancer. So I felt like I needed to, because I was going through my own struggles, and I didn't want to put that more on Dustin. And I did it for a short term, but I felt like communicating to somebody else was not true to my heart. So I learned to open up a lot more with Dustin on what I was thinking and feeling at the time I was going through my treatment. So,
and that's awesome.
I just
Thank you for sharing.
My heart.
Thank you. And thank you for sharing that you went, because what we know about therapy is that some people use it for a short time and learn the lessons that they feel move forward. Some people go in and out of therapy, and some people are in it for a longer term, and there's no shame in it, because no one even has to know about it. So thank you for sharing that you did go through that journey. You talked a bit.
But there's nothing wrong with going through a therapist.
Not at all. At all. I go to my own therapist. Super, it relinquishes you of things that sometimes you can't tell other people. It's amazing, especially with the right person, right?
Exactly. And trust me, I call that therapist and say, you need to see Dustin.
Yeah.
Trust me.
That's great.
It's tough.
Yeah. You touched a bit on suicide when you were talking, and and I'm grateful that you did, because next month, like I said, we're going to be welcoming the suicidologist from UCF Restores on here to dive more into that topic. Huge topic for us to get into. But what you said when you were talking about suicide was that sometimes you see when Dustin's getting to a point where he needs a break. And not every loved one of a first responder is able to have these kind of conversations of, I noticed that you need a break. How do you start that conversation with Dustin?
I just say, I come out and say, you need a break. because I see it. I wait and I wait. And then when I finally get to the point where he is doing too much for such a long period of time and taking on a lot of different tasks and a lot of different things, with whether it's the fire department or things at home, or I I think it's me as the person, as I just say, Dustin, you need to have a coming to Jesus talk with me, and we need to take a break, and we need to do it together. And as soon as I say that, as God is my witness, he stops and we take that break.
That's awesome that you
And
were able to grow to a point that you were open enough to have that conversation with each other without pushback, from a love place. That's amazing.
it takes work, though.
Pardon?
It takes work.
Yeah,
It takes work.
it does. What relationship doesn't, right? So that's an important message too. Last question. This is the family and caregiver stuff, and this is my last question, and then we'll open up the floor. You talked about the importance of having family time together. Do you guys have any guidelines for your family time? No TV, no phones, whatever. Do you have guidelines for that?
Well, TV, as far as TV, we don't, very, very rarely do we watch TV. We spend our time out in our yard. We're not social media people, but you mean what do we do, or what do you mean? Can you rephrase that for me?
Well, for example, you don't use TV in your house during that time, right? You're not social media people, so phones aren't on, or how do you create a space where you are valuing each other's time in a day and age where we're inundated with those types of things?
Well, true. That's very true. It's hard with what Dustin does with the fire department and the collaborative, but we find time, whether it's first thing in the morning or dinner time. I'm a fanatic and always have been, and I will not stray from that. Is we will sit down and have dinner every night. That is a must for me, and I will not stray from that. We will have a full dinner, and anybody that knows me knows that that's very important to me, and I'm firm on that one. I get cranky if I can't do that.
Thank you for sharing that, and for answering
Sure.
my follow-up questions. With that, I'd love
Sure.
to open the floor to everybody else who's here this evening. If they have any follow-up questions for Miss Lynn or even Dustin, we would love for you to ask those questions.
Sure.
And if not, that's okay too, because we're going to provide everybody with your contact information for a follow-up email if they'd like to ask you in private. Certainly, that's more than fine.
Michelle, you have a lot of important questions. Did. And I feel blessed. Thank you for having me.
Someone's chiming in there. Is that you, Brianne?
Yes. So if obviously, like, there wasn't for you pushback on, I guess I can go, there we go. There wasn't pushback on approaching him about like taking a break. So I guess anything that like you prepared yourself for if and when there was pushback, like, did you think like, okay, maybe I won't ask at a time where it's really bad. Maybe I'll ask, how do I approach this when you get to the place that you need a break? How do you want me to approach you about it? Or did you find anything, I guess, that worked or that you thought through ahead of time in case he was going to push back?
I think that a lot of things, with traveling and our daily jobs and things like that, depending on calls that, Dustin may have had, and he comes home and I can tell that it's been a rough day, and we had some things that we wanted to do. A pushback would be, I think, Dustin, there are times when there are things that it's imperative that it's a timeline for him that he has to reach. So I see that, and I'm grateful that he keeps the communication open with I have to do this by this certain time. So keeping the line of communication over with a schedule or a task that has to be completed is important, because trust me, it's not that Dustin always doesn't always push back and say, I have to do this first. He doesn't say that, but I can see it in his eyes and I can see it in his heart that he has other things that are pressing, but he does not want to, he wants to embrace the fact that I'm asking for something and I don't normally ask for things. So that's a hard thing to answer for people that struggle with trying to get their husbands or the wives to stop and focus on what, when you first met, you guys used to like doing, and you know, embracing just doing something like going for a walk on the beach. You know, sometimes that's all it takes to have that person open up and just relax and step back for a little bit. Did that answer your question, Brianne?
Yeah, thanks.
Does anybody else
So
have
hi, Lynn.
questions?
Oh, it's Michael. Can you hear me?
Yes.
I can hear you, Michael.
Okay, I have a question for you. You're a nurse, correct?
Correct.
So, as a first responder who had a spouse who was not a nurse, what was it about being a nurse that you think helped you to get through that process? And what advice do you think that you can give to someone who may not have that background?
You mean when Dustin was hurt?
Yeah.
Whew. I can tell you one thing, being in my profession, I had no flipping clue what was coming at me. All I saw, I didn't see anything else but the pain that Dustin was going through. I can tell you 100% that my profession, even if I could have been a window washer, and all I could just see was Dustin hurting, and I wanted so bad to help him with his pain. I can tell you at Orlando Hospital, the majority of the nurses, probably 99% of Dustin's nurses were men, and they were absolute saints, because that is not an easy profession at all. Seeing people in excruciating pain 24/7. It's very difficult. Very difficult. Yeah. So you're welcome. Thank you, Michael.
Does anybody else have any questions for Miss Lynn before we stop the recording? Okay. Well, Miss Lynn, thank you for sharing
Yes.
your journey with us. We are grateful to have you here tonight. I will provide your follow-up information to the emails that everybody provides to us. And we look forward to having you again in the future. You keep up the good fight and you keep that smile on your face, because we love you.
Love you too. Thanks, everybody.